Adalimumab is a prescription biologic medicine used to treat several autoimmune and inflammatory conditions. It is commonly prescribed for diseases such as rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, Crohn's disease, ulcerative colitis, and plaque psoriasis. These conditions occur when the immune system becomes overactive and starts attacking the body's own tissues. After adalimumab is injected under the skin, the medicine slowly spreads into the body's tissues and enters the bloodstream through the lymphatic system. As it circulates, it targets a specific immune protein called tumor necrosis factor alpha, or TNF-alpha, which plays a major role in causing inflammation and pain. By blocking TNF-alpha, adalimumab helps reduce inflammation at its source. This leads to decreased joint swelling, less pain, improved movement, and healing of inflamed tissues in the joints, intestines, or skin. Over time, this helps patients manage symptoms and slow disease progression. However, because adalimumab suppresses part of the immune system, it can increase the risk of infections. Some people may also experience injection site reactions, fatigue, or headaches. Regular medical monitoring is important while using this medicine. Always use adalimumab exactly as prescribed by a healthcare professional.